Good evening, everyone. I'm Dr. Heta Patel from IAP Digital Media team. I will be hosting for the today's webinar, which is on research problem and a research question, even the research design, with the resource person, Dr. Ashish Kakkad sir, and myself, being organized by IAP Research Committee and IAP Women's Cell Kheda. The Indian Association of Physiotherapists is the oldest and largest association representing physiotherapists in India since 1955. The IAP digital media team consists of a group of physios who handle the Zoom platform, webinar live streaming, and IAP profiles on social media platforms Facebook, Instagram, Twitter, LinkedIn, YouTube. Follow the IAP profiles on this social media to receive the notification for our events such as webinar, workshops, CMEs, conferences, health camps, blood donation drive, and to know about recent updates on physiotherapy. Subscribe to IAP YouTube channel for notification of our live webinars in the playlist section of this channel. Webinars are segregated into various folders on the topic like orthopedics, neurology, sports and fitness, pediatrics, research, cardiopulmonary, women's health, cancer rehab, and many more. For the easy access, the social media link will be shared in the chat shortly. Further today, the moderator is Dr. Grishma Shah, who is an assistant professor at Ashok and Rita Patel Institute of Physiotherapy, and she is an active member of IAP Women's Cell Kheda. Over to you, ma'am.
Uh, Good evening, everyone. Thank you, ma'am. I warmly welcome you all to the session of this session of virtual research series organized by IAP Research Committee and IAPWC Kheda. Research begins not with the data, statistics, or analysis, but with a curious mind asking the right question. So today's topic is research problem and research question, which forms the very foundation of any meaningful research study. A well-defined problem guides the entire research process from selecting methodology to interpreting results. So it is my privilege to welcome the speaker of today's session, Dr. Heta Patel ma'am. Dr. Heta ma'am is currently serving as an assistant professor at Ashok and Rita Patel Institute of Physiotherapy, Jalsar, and she is an active member, IAPWC Coordinator Kheda. She has completed her PhD with an research area focusing on development and validation of tools to identify early symptoms of patellofemoral arthritis. Heta ma'am has an impressive academic and research profile with multiple research publications, patents, book chapters, and competitive research grants to her credit. Her work has been recognized internationally, and she was a bursary recipient at the World Physiotherapy Congress, Dubai, reflecting the global relevance of her research contribution. Her research interest includes knowledge translation, early knee pain, preventive strategies, development of self-analysis tools, and virtual reality-based rehabilitation. Beyond her academic achievements, she actively contributes to various professional and academic leadership, and she is currently serving as a head of cultural committee for the upcoming WAWB conference. So with her rich experience in research, innovation, and academia, we are indeed fortunate to have her guide us today on this very important topic. So I now invite Dr. Heta ma'am to take over the session and enlighten us on research problem and research question. So thank you, ma'am. The platform is all yours.
Thank you so much for the introduction. I truly appreciate your words, and I'm grateful for the opportunity to be here with you with my another domain of research. Uh, Let me share my screen. Just a minute. Okay, is it visible, right?
Yes, ma'am. It is visible.
Is it anywhere it is showing that black dots or something? Or shall I proceed?
No, ma'am. You can slide show. Yeah, done. Perfect, ma'am.
Okay, just now it is slideshow only, right? No.
Yes, now it is slideshow, ma'am.
Okay. So um we'll start. Just a minute. Ma'am, is it like visible?
Yes, ma'am, it is
Full
visible.
screen visible, right?
Full screen visible, yes.
Okay. No.
Now it is not. Previously, it was in a full screen.
Okay. Just a minute. From the current slide. Fine.
Yes, done, ma'am.
Are, what happens? Is it fine?
Now it is fine, ma'am.
Just a minute. Why it is not?
Done, ma'am.
I
Slide.
cannot be able to click.
Okay.
Okay. So for the research problem and the research question, right? The topic itself, it's in foundation for the research. For this today, I just would like to have start with one story. Like there is one physiotherapist, and in her clinic, the two patients come there to visit the clinic, and during this time, they got the same treatment for like 1 or 2 week. After 2 week in the reassessment session, she noticed that one patient is improving very well, and he's about to discharge. But while seeing the other patient, he's not at all he's not at all able to into a verge of discharge. So why it is happen? Because she's giving the same treatment to them. So why it happens? Anybody can answer this? See, it is about research question, right? So question is the part of this session. So everyone needs to answer here. And I think we have 95 participants are there. So let's answer. One is getting the good treatment, one is not. Why it happens? Anybody can answer? Okay. Ma'am, can you please help me to read out?
Yeah. Sure, there are ma'am few answers. Individual contextual factors, age-related issues, people are
Okay.
differently treated, each body is different. It is
Uh,
multifactorial.
okay. So in that case, it is like to both are the same age, both are the same gender, both are coming from same background, and they both are receiving the same treatment.
Someone has stated a psychological aspect or motivation.
Yes, yes, that can be also the option, right? So you are giving the directly an answer. So in this answer, first we need to ask, right? First, prepare a question, then we can able to answer very well. So in this, she has the question: why does the same treatment give the different result? And that is might be your that is our curiosity, right? So why it is there? It is in same treatment give a different kind of results. So to answer this, for this session we will be having. So in this session, we'll be having what we'll have. First is to understand the research problem. Second is to learn the research question formation. Third is to apply the framework, and fourth is to develop the reasoning. So after end of this session, we'll be having this. We'll complete these objectives, right? And after that, we'll be having one quiz as well. Today I have posted that the quiz round will be having, and based on that, you will get a e-certificate. So stay tuned for this as well. So research problem. First we'll talk about problem, then based on that we'll talk about the question. So research, what is research problem? So research problem is something which is like gap in the knowledge, right? It might be because the variety of references you might refer, and it might be you end up into some gap in this knowledge, right? It is clinical issue, It is unaware answers and unaware, even the unanswered questions are there, right? So problem is something from this, like from this, the problem may arise. Now, how you can identify this problem? So for identifying any sort of problem, you need to reach to the root cause. Root cause, if I'll take that example, the root cause, she as in our physiotherapist can take that, it might be like root cause of treatment, or any there is any gait pattern difficulty, or any difference in that specific their like daily living activities. It might be because of any sort of reason can be there. So that problem needs to identify first by that physiotherapist, right? And then after that, once it is being identified, then we need to work on that. So our aim, first and foremost aim, is to have the clear cut, researchable, relevant and feasible research problem. Then only it can be titled as good research problem. So for good research problem, CRRF, so it needs to be clear, researchable, relevant, and feasible. If you have a good identified problem, then only you can able to define those things. Now, which are the sources that you can identify the problem? So first is from the clinical sites. You can identify, you can see the patients, you can have the interaction with them, even you can assess them, right, by your assessment, by your examination. After that, what next thing is literature. You will search for the literature. In yesterday's series, what we have seen, ma'am has very good, ma'am has given that narrative review can be effective for this sort of literature, right? And after that, the scoping review also, the systematic search also can be the effective one, right? So again, if you are not aware, unaware into that, you can take the expert help as well. The expert opinion also matters, right? And you also need to look for the social issues, right? In general community also you need to look for. So research problem you have identified, that's CRRF. Then after that, what you need to have? You need to have the research question. This, which is my second topic. So research question. Research question is something you need to ask. You need to be curious about that. You need to have some curiosity in that. Along with that, you need to have the patience, right? So when you ask a question, it needs to be specific. In our case, the specificity is, what is the specific one? The specific one is, anybody can answer. What is the specific things? The specific thing is they have the treatment, right? The treatment is a very specific. It needs to be focused and it is needs to be answerable. So in our case, it is the same treatment is there, same patient is there, sorry, no, same treatment, same condition is there, and the same specific, they are like receiving, the site is also the same, right? But the outcome is one outcome is poor, one outcome is excellent, right? So that needs to be answerable. Next is it is an one kind of two side, problem and question, right? So problem is very broad area, while question is very narrow area. So from one problem, it can be a multiple question. So one problem can be a, you can have a multiple like questions, that it might be because of gait, it might be because of like their daily living, it might be because of any other sort of activities they are doing. So that can be the multiple questions that is being formed. If I'll take one another example, there is an increasing knee pain in physiotherapy, in physiotherapy OPD. Now, which are the questions? Which are the possible questions? So here I have noted down some questions. Even you also can have some questions, right? So I'll ask that as well. Does the outgoing gait increases the knee load? Is the muscle imbalance which is associated with patellofemoral pain, or does the retraining reduces the symptom, right? Any other? Does it there any effect of cold or a weather effect, right? That also can be the question. So question can be multiple, right? Problem is one, right? It is very like that broad area, but question can be the multiple. So we need to narrow down of our focused area and other specific problem. So if we'll see, it can be how we can think about it of your research question of your study. First is observation. So you can observe some, you can even notice some patients, their gait patterns or their specific ADL function that you can have it and you can compare it with the normal patients, right? Second, you have identified that problem. Then after you have to convert that problem into question, and after that, once again, what you can do, you can plan that study, right? So which study design will be there, that will be taken by my fellow colleague Dr. Ashish Kakkad sir. So till question we will discuss for the day, right? So for forming a question, there are certain formats are there. One is Pico, you all might be aware, right? Next is Picot, then next is PECO, right? Then Spider. Then again, there is one more Spider also there for the qualitative evaluation, right? Then next will be Finer, right? So what is Pico? The full form it is being given in on your screen, right? So that is population intervention comparison outcome. In Picot, there is an T is added, so there is a time. In Pico, there is a population exposure comparison and outcome. So in Pico, you can, it is best for intervention kind of study, that kind of RCTs. PICO is best for clinical trial with duration, and PICO is for risk factor analysis, that sort of observational sort of studies. It is important. Now, SPIDER, which is a sample phenomena of interest, design, evaluation, research type. So it is most suitable for experiences and perceptions, right? So patient perceptions, that qualitative kind of research, it is most important, right? Again, Spider is for feasible, interesting, novel, ethical. So evaluating research questions as well, and even research validity kind of study also. The Spider is also important. Another is Finer. Finer is feasible, interesting, novel, ethical, and relevant. So it is for a validation sort of study. It is important. Uh, let's have one activity. One problem is being identified, right? Which I have take up. That is high knee pain in the female runners, right? So high knee pain, that is a problem. Now your task is to convert into a research question, identify the framework. So I would like to you people please raise the hand. I'll promote you or I'll allow to speak. So how you can convert into a research question and which framework can be identified. Let's have that. Let's have that. How you can convert into a research question. Your problem is there. It is very wide. High knee pain in the female runner. Now how you can do that? Anybody can answer. Because of overuse. Oh, sorry. Yeah, I can. Because of overuse, improper exercise, muscle imbalance, inflammation, or progression of pathology. Specific also seem like precise, focus, evidence based too. Yes, ma'am. Dr. Megha, right? Okay. What are the causes and effective treatment strategies? Yes. Does the high knee pain in female runners effect on performance? Why is there is an high knee pain in female runners? Okay. Is the knee pain due to overstrain and without proper warm up exercise? What is the prevalence? Vaishnavi said that what is the prevalence of high knee pain in female runners? Mansi's answered that is there any estrogen influence in female runners causing this? Karishma said what is associated risk factor? Megha said that you have pain during running. What is the prevalence of high knee pain? Roshni answered. Nandini. Okay, well. So here you have provided the question, right? So I told you that it is question, right? So question needs to be formed using our previous one, right? What we have that we have just now learned that the previous one in that we have learned the different formats, right? So the question is specifically related to it is about the knee pain and physiotherapy, right? So that is specifically related to PICO, right? Because it is an effectiveness you are checking. So if at all effectiveness, then it is RCT studies. For RCT, there is an PICO format is being used, right? Now, how you can convert? You have population with you, runner, female runners, right? Interventions, physiotherapy intervention, comparison again the in physiotherapy specific interventions to runners, female physio, right? And that outcome is improving the knee pain or deteriorating, right? So outcome might be you can take VAS, NPRS, that sort of thing, right? So this is something. Is there any so how we can convert this is the framework which can be used. And if you are adding the time frame of 6 months, 7 months of treatment or 3 months of treatment, so then it can be PICO, right? So what can be the question? What can be the question? Is the treatment like blank whatever the treatment you wanted to identify, right? Is the treatment is effective in high knee pain in female runners, right? So that includes your all four PCOT, right? Population, intervention, comparison, and outcome. So a good question is clear, focused, feasible, and ethical. One of the said is that uh, the clear cut question can solve half of their problem, right? So it needs to be a clear, focused, visible, and ethical, and that is only and only possible with the use of these frameworks. Now, what mistakes we did? First is not at all using this sort of framework. That is first. Second is it is too broad sometime and when it is too broad it is might be a vague, and it is sometimes not measurable as well because we are not adding some outcomes or some any sort of thing, so that can be not measurable as well. So these are the mistakes is being done generally in the from a clinical practice to academic in transition. These are the specific mistakes are being done. So what is the specific process? First, you need to identify the problem, which is very broad. Next is you need to do the literature search. It can be narrative or scoping. After that, the literature search can do the narrowing of the specific research gap, and after that you need to form the research question, right? So what are the importance? First is it guides the researcher, it directs the methods, and even it will be giving the effective results. And that sounds as in good research practice. Many a time you end up with like what is the problem, what is the question, problem, question to problem. These are your major focus area, but you only need to have it with the literature review. You need to do the extensive literature review by after identifying the problem. So here I have some quiz, right? Dr. Megha, right? She has messaged me when the quiz will be there. So here is the quiz. A patient with the knee osteoarthritis shows anterior knee pain. And what is the best format? Here we have What can be the answer? Yes, pico or pic. Here the pico can be used. Even it is not even in there in the question, sorry, answer, but picot also can be used if you are adding the time frame. Studying the IT workers' posture, exposure causing back pain, which is the best format? Here the exposure one. So which is the best format? PECO. Yes, that can be exposure kind of study. Okay. Next is undertaking. Understanding the patient experience after stroke rehabilitation, which is the best format. So it is qualitative kind of research. So it is spider, right? So in nutshell, the problem need to identify, and that can lead to a question. You have to use the framework, and you have to be a specific. So initially I told you one story regarding two same patients when one for therapist and all, right? So how now have you, if you are in that shoe, how you will think, what you will do, what you will do, as in if you will be that therapist, what are your strategies, what you will do, how you will think. So first, what you will do, you will take assessment, very good, but you will identify, and while doing assessment you will identify the problem, right? Then why the other patient is not being treated, like the treatment is not effective, so that you will analyze. Then you will analyze the response, yes, okay, but then you will find the that problem. Then you will, what you will do, you will framework, use that framework and frame the question, right? And after that, that framing the, after framing a question, what you will have, that will be taken by Dr. Ashish sir, how we will design the study and all. Okay. Thank you so much for the listening. And if you have any such query on framework or research question or problem related thing, you can write me in on my email, or you can have the, even though this is my WhatsApp number, you can ping me there as well.
Uh, Thank you, Heta ma'am. Thank you for such an insightful and engaging session. I invite participants to write any query in the chat box. We'll try to address them.
Yes, definitely will guide you for the MPT neurology as well. Since I'm a musculoskeletal therapist, but the research question and problem we can discuss. Yes,
Sure.
Vaishnav, we can discuss. How to decide the framework and best mixed clinical situation. For deciding the framework, PICO or PICO, you first need to identify the problem, what you have identified. You wanted to see the treatment or you wanted to see the exposure. That you need to identify. And after that, based on that, you can have the practice. I still have 1 minute, right?
Yes, ma'am.
Okay. Nirmala, pediatric neuro PhD study, cause experimental study. Good as RCT is not possible. That we can take it into our last session, which is taken by Nehal madam. That we'll discuss. Nirmala surely will discuss on the last day. There is nothing is wrong, or nothing is good or bad. It's just you need to frame the things. Which best question framework? Again, needs to be decided based on the problem. What minimum sample size do I see? Again, that we'll discuss in the, I think Gopi ma'am will take that. How many research questions can be added in one study? Again, that depends on the your problem. What common mistakes students, we have discussed in that specific, the common mistakes which is being done, that is with you are selecting very broad area, not will focus and not to be specific. You just write me whatever the queries are there, ma'am. You can continue for the next session.
Sure.
Good evening,
Thank you,
sir.
ma'am. Thank you, ma'am. Thank you for a wonderful session. I'm sure the participants will be more clear on how to formulate a problem and the research question through it. So a well-defined research question prepares our mind, but the next critical step is choosing the right research design to answer that question effectively. Because even the most interesting research can lose its impact if it is not supported by an appropriate and rigorous research design. So this brings us perfectly to our next session of the day. It is my pleasure to introduce our next speaker, Dr. Ashish Kakkad sir. Dr. Ashish sir is currently serving as a professor and principal at the Faculty of Physiotherapy, Marwari University, Rajkot. Sir specializes in neurological condition and has earned PhD with a research focused on designing and testing a predictive model for post-stroke recovery. Ashish sir has an extensive academic and research profile with numerous research publications across national and international journals. He has also authored a book of Fundamental of Electrotherapy and Biomedical Physics. He has also been recognized for his professional contribution with awards such as Significant Contribution Award and Young Achievement Award. Beyond academics, he has played an important leadership role in the profession, serving as an VP of Gujarat State Council for Physiotherapy, and he is currently serving as committee member of Physiotherapy Professional Council under NCAHP, Government of India. With his vast experience in clinical research, academia, and professional leadership, we are privileged to have him guide us today. I now invite Dr. Ashish sir to take over the session and enlighten us on the very important topic of research design. We welcome you, sir.
So, thank you, madam. Thank you, madam. Good evening for this nice introduction. So, first of all, let me share my screen. So, hello,
Yes, sir.
is my screen visible to all?
No, sir.
Okay, just give me
Yes,
a
now it
minute.
is visible, sir.
It is visible. Okay, fine. So, good evening. First of all, I would like to thank to IAP Kheda branch and Heta madam for giving me this opportunity. So, myself, Dr. Ashish Kakkad, professor and principal at Faculty of Physiotherapy, Marwari University. So, as it is just 30 minutes of time, first of all, I would like to listen from the participants or the students. What is their expectation from this class? Like, do you know what is research design or what is your expectation? If you're writing in chat, I'll go to chat. Okay. So, my topic is research design and I want to learn in detail. Okay, understanding research design. So that's very good. So let's go to that part only directly. So my do we need to okay. Okay, fine. So I'm sharing my screen and I hope it is visible to all of you. So today's topic is research design. So research design means what? It's like something you are planning before you start it. I can give you one, two examples. Like for example, if you are going for purchasing any building or property, so before the construction of this building starts or before the actual event happens, before that there will be proper plan. Like on paper, you will be able to see what will be the size of the bedroom, what will be size of the window, what will be the size of the living area. Okay, so before the building is constructed, everything is put on paper with all minute details. That is known as design of the building. Okay, for example, if you people are planning to go for any tour, okay, like just imagine you are planning a tour for Singapore. Okay, so the tour manager will give you the itinerary, like okay, 5 days 4 nights, okay, you will have to depart at this time, you will travel from this destination to that destination by air or by road, whatever, fine. So every minute details are mentioned. Okay, so that is your tour design. In the similar way, we have research design. So before you start your research, certain parameters they need to be decided. Sometimes you need to go for review of literature, like whatever it is already done that you need to search about. Then sometimes you need to discuss, you need to do brainstorming with others. Okay, so what you are planning, or what is your framework, that is your design. So it's very simple. Research design is, it is your plan or framework, or you can say it is outline of your approach and the methods for data collection, which analysis will be used by you, which will be the research question, how will you test the hypothesis. Okay, so everything before actually you perform, before actually you execute, okay, you are putting on paper. So that is your research design. Now, which are the research design elements, like the skeleton? Like as I said, like if we are thinking of the flag design, so there are some elements, no, like there will be room, there will be kitchen, there will be washroom. Okay, so all these are different elements. So in the similar way, for research design also, there are few elements. What is required here? So it can be explained. So, first of all, the clear purpose, why you are doing this research. So, throughout this session, let's understand with simple example. Like I want to check the effect of ultrasound on pain in osteoarthritis knee patient. Okay, so recently madam also explained pico format. So here my population is osteoarthritis knee patient. What is my independent variable? So that is ultrasound. What is my dependent variable? So pain. How I will check the pain? So outcome measure for this dependent variable is like VAS or NPRS, visual analog scale, or numerical pain rating scale, whatever. Fine. So what I want to check, it is my purpose. So that is nothing but research question or hypothesis. So for this example, throughout session we'll continue with this example so that you can correlate everything. So research question or hypothesis will be like this: effect of ultrasound on pain in osteoarthritis knee patient. So one hypothesis may be whether it is effective, other hypothesis will be it is not effective. But what is my purpose? Effect of ultrasound on pain in osteoarthritis knee patient, I want to check. Fine. Then comes type of research methodology. Okay, see, one thing I would like to say here, don't get confused between the research design and study design. Both are different. Study design is something like whether it is observational, interventional. There are subtypes also of observational, interventional. So that is study design. Here we are thinking of deciding overall approach for the study, that is study design. So study design is part of research design. Fine. So which type of the study you are doing, like whether it is observational, interventional, etc. Then comes sampling. Can anyone say what is sampling? What is sampling? Okay, fine. See, there are two terminologies. One is sampling, other is population. Population is the larger thing. Okay, for example, I would like to say if you want to purchase 100 kg of grain, okay, so you don't check each and every seed of this 100 kg. Okay, what will you do? You will simply take in your hand few seeds, maybe 20, 25 maximum. Okay, and then you decide from 25 seeds, you will decide that I will be purchasing this 50 kg or 100 kg of grain. Fine. So that is sampling. One is sampling those 25 seeds, and one is 50 kg of grain. So that is population. See, like in COVID also, initially sampling was done on 100 people only, then 400, and then it was given to crores and crores of population in India. Fine. So this is sampling. What will be your sample size? So there are many sample size calculators. So you should decide from the beginning only what will be your sample size, how you will collect these samples, what will be the inclusion and exclusion criteria. Inclusion criteria means which should be included, exclusion means which should not be included. Fine. Then time frame. Sometimes we also have the word time points. So like ultrasound, if I want to give, so I'll have to decide like what will be the intensity, what will be the duration, like 8 days, 10 days, 4 days. It should be uniform for all the patients. Like if I am deciding for 8 days, it should be 8 days for all the subjects. Fine. So that is time frame. When you will get the data, so one is before starting the treatment, that is 0 day. Okay, and then you take after 8 days. So that is timeline or time point, duration. Sometimes we go for follow up also, like patient has already completed ultrasound 8 sessions, pain was relieved. Now we check again after 8 days. So now ultrasound is not given in last 8 days, it was given before for the 8 days. So now again we are checking whether the effect is permanent or not. Fine. So this is example of time frame. Data collection, so as I said, whether it will be by interview method, whether it will be by examination, whether it is by an investigation, okay, whether it is self reported, okay, so all these are different types of examples. Which tool are you using? So for in our example, ultrasound osteoarthritis, our tools may be like, it may be visual analog scale, it may be numerical pain rating scales. All these are tools. Tools may be machine also, tools may be scale also. Okay, all this data collection will be decided from the beginning. Ethical consideration. See, ethics. Being a physiotherapist, we are proud that we are learning ethics. It's not there in all the programs, and that's why you know where the society is going. But ethics means that is moral responsibility of the researcher, that if he or she is doing any research, it should not be harmful in any manner to the participants of research. Okay, so ideally there should be SEDESCO approved committee, that is Central Drug Standard Corporation from the New Delhi. So we have to apply to that, and then we get the approval. Okay, then data analysis. So whatever the data I will collect, after that what? Okay, after that I'll have to apply for different statistical tests. That may be t-test, z-test, that may be Wilcoxon test. There are many tests, so that you will learn in biostatistics separately, but this should be decided from the beginning. And resources. See, to do anything you need budget, you need space, you need manpower. So all these things you need to decide from where you will manage the funding budget, from where you will recruit the research assistant. Okay, maybe some other needs like in form of infrastructure. See, if any PG student or intern wants to do research like ultrasound effect of ultrasound on pain in osteoarthritis knee, so, do they go for purchasing ultrasound? Have you seen any intern or MPT student purchasing ultrasound for his research? It is provided by the institute. So, it is nothing but one type of the infrastructure requirement. Okay, so all these things should be decided from the beginning. Like today only, I got one request from the PG student, like we want to purchase this machine, but it is showing out of stock, even on online purchase and some vendors also. So definitely, if I include in my research design that I will be using this device, but later on it's not available to me, so I will be in trouble. So it all should be decided from the beginning only. Okay, so all these are clear components. Now, characteristics of research design. So these are a few terminologies we should consider. One is neutrality. There should not be any bias. See, many a times we, from the beginning only, we are biased to one side. I have seen few titles also, like if I want to prepare title like this, improvement due to ultrasound in pain in osteoarthritis knee patients. Actually, it is biased. From the beginning only, I am saying that it is improved. Sometimes we also get this kind of the answers from the students or some researchers, like if I give this it will be more effective, but how can you say before you start the research? Okay, you just have to say that, okay, I want to see the effect of ultrasound on pain in osteoarthritis knee patient. Ultrasound may improve the pain, may maintain the pain, may worsen the pain. We don't know. Okay, so there should not be any bias before you start. You should be ready to accept any result that comes after your research, and that is actual research. See, what is research? It's research. You have to search it again and again. So if you are biased to one side, then there is no meaning of doing research. You should be very neutral before you start. Okay, then comes reliability, validity. So reliability means if you repeat the observation should not change. Very simple example, if I take my weight on second floor, it should be same. If I take on fourth floor, it should be same. If I take in morning or evening, it should be same. Then my weighing machine is reliable. Okay, sometimes we say, like this person is not reliable. Means what? He is changing his statement frequently. So that is applicable for machine also. Machine reliable means it should be giving you consistent observation. Fine. Then comes validity. So validity means it will measure what it is supposed to measure by technical definition. So in very simple term, you can say that validity means it is accuracy. If my weight is 80 kg, weighing machine should go 80 only. If it goes to 81 or 79, means it is not valid. Okay. So validity means it is accuracy, you can say. Generalizability. See, you do research on some limited part of sample, then it should be applicable to whole population. Very simple example, COVID vaccine. We all are the witness. Okay. Am I audible properly? Someone please answer.
Yes,
Yes.
sir, you are audible.
Okay. Thank you. So, if we think of COVID vaccine, so as I said, COVID vaccine was given to 100 and 400 people, and then it was given to all of the Indian citizens. But it was not given to kids. It was not given to pregnant ladies. What does it mean? It means that it was tested on healthy adults only. It was not tested on PDA population. It was not tested on pregnant ladies. See, we all are the witness of this era. So generalizability means whatever you do, it should be applicable to larger population. Then and then your research is like worth. Otherwise, you are wasting your time and energy. Okay. Some flexibility is always to be given, and the researcher should be accepting it also. Like as I said in the beginning of the session, like if tour manager gives you plan, like okay, this is your first day, you will have to start at 9 a.m, you will reach by cab, and you will be going to airport. From airport this flight will start at this time, and arrival is at this time. Okay, so everything is there on paper, but is it possible to follow exactly? It's not possible. It is happening only with president. See, Indian president, it has like minute to minute schedule, but it's not applicable for other than president. Okay, so the thing is flexibility should also be given, like whatever you have decided, if it is deviated slightly but not at the compromise of some core elements. Okay, so researchers should be flexible enough to accept all these changes. Now different types, so very roughly there are two types: qualitative research and quantitative research. Qualitative means like it's without numbers, without units. Obviously, if there are no numbers, there will not be unit. Okay. Quantitative means it is with number, it is with units. Like if I say fever, so mild, moderate, severe fever. So that is what? Subjective data. It is qualitative data. If I say that he is thin, he is obese, so it is qualitative data. But if I want to make it quantitative, so instead of mild, moderate, severe fever, what will I say? Okay, fever is 101 degree Fahrenheit. Fever is 102 degree Fahrenheit. So degree Fahrenheit is your unit, and 101, 102, 103, these are numbers. So if the numbers are coming, units are coming, it is quantitative. So it is measurable. Fine. Okay, so this is quantitative research. So it has all the objective data, and statistical analysis will be possible. Fine. But qualitative research means it is subjective, more of subjective, more of exploratory and interview based data. Fine. See, this is qualitative research. So as we discussed, it is subjective. So here, see, this is discussion, some question answer, so that is qualitative research. Okay. uh, for example, if you are doing brainstorming on clinic, like okay, this patient improved slightly, this patient had worsened, so that is qualitative discussion that is going on. But if you talk like this, that was this vase was 7 before 3 days, now the vase is 4 today, so it is quantitative. So it is all about numbers and graphs, you can see. Fine. So some examples of qualitative, so that is grounded theory, thematic analysis, disclosure analysis. I'm not going in much detail, otherwise it is too long, but at least you should have this idea of terminology. So you can just one example of thematic analysis I would like to say. For example, when I started, so I ask you one question, like what is expected from me. So one student may ask like, okay sir, I want to learn definition. One student may ask like, sir, I want to learn how to prepare the flow chart. One student may say that, okay sir, I am more interested to learn the statistical analysis. Okay, so this is nothing but it is kind of thematic analysis. At one point of time it will happen that the request is saturated, like whatever 4 5 10 expectations are happening from the sessions, those only will be repeated. Okay, so this is nothing but qualitative kind of research. Some quantitative research, so that is descriptive research design. Descriptive means what? It's simple, like mean standard deviation. This many percentage female are affected, this many percentage males are affected. No any major statistical test will happen. Okay, but it is like simple statistics. It is known as descriptive analysis. Then comes correlational, like if my height increases, okay, body mass index decreases, so that is negative correlation. If my weight increases, body mass index increases, so that is correlation, positive correlation. But again, here you need numbers: weight, BMI, height. Okay, so all these are numbers, so that is correlational. Positive, negative, no correlation. Right? In positive, negative also there is absolute, relative. All these are different correlation. You may search more for getting more idea. Then some of the research are diagnostic. Okay, so lab investigation, some clinical scales, all this will be falling into diagnostic, where you have again number, like blood sugar, blood pressure. Okay, all these are numbers. Explanatory research, so when someone has limited prior information about anything, so they need to search for more information. Like, okay, blood sugar this much. Now when urine sugar is present, this is the problem. When it is absent, this is the problem. Okay, so more information will be added to already existing research. Some of them they are casual research, like maybe some relationship, we want to find out between the two parameters. Like if someone gives vitamin A and D dosage, the height of the kids will increase. This is kind of examples. Fine. See here, one example is mentioned: school dropout and some bullying accident. Okay, so that is bullying means it is antisocial activity. So someone who is criminal, there are more chances that he is school dropout or college dropout. So it is casual research design. The unknown relationship is being found. Fine. Then experimental research. See here, it is very important. It is cause to effect. Cause to effect. Like what example we gave? It is effect of ultrasound on pain relief. That is cause to effect. Some research are retrospective. Ultrasound effect on pain relief, it is prospective research. Now for example, if I want to identify the effect of smoking on lung cancer, how can I do? I cannot say that I will recruit 10 boys and 10 girls. I'll give them 20 cigarettes to smoke every day. Then I'll measure the lung capacity after 5 years. Is it possible? No, it is not ethical. So sometimes it is cause to effect, sometimes it is effect to cause. So I'll have to go reverse, retrospective. Those who are having lung cancer, how many of you were smoking? Those who are having oral cancer, how many of you were taking tobacco? Okay, so that is known as experimental design. It may be from cause to effect, that is prospective. It may be from effect to cause, that is reverse. Fine. And what are the benefits of this? So there are advantages if you plan the research design from the beginning. You will be having some valid instruments. You will be able to find out. Then sometimes what happens if you are not planning in the advance? You do the research and someone from the audience will object or reader will object. This is not valid one. So reliable, valid. It should be efficient also. There should be clear direction, like what ultrasound I will be giving, which stroke I will be using, linear, circular, spiral, what should be the dosage, whether I will use diclofenac or not. All these clear directions are required. You cannot only check on some independent variable, you should also keep some control group. Okay, those who are not getting ultrasound, then only you will be able to identify that whether ultrasound was effective or it was natural recovery. Fine. So all these are control groups are required where you are giving some shame treatment or you will give some placebo treatment. Replica. Research is not like that. Okay, I have done. It's not like Taj Mahal, like once constructed, nobody should be able to construct next time. It is totally different. The name itself, it is research. Whatever you have done, someone should be able to replicate it also. Someone may cross validate your study. So if your information is not proper, it means that your research is not good. Okay, so here we don't have to follow the Taj Mahal theory that no another Taj Mahal should be constructed next time. Here, whatever you do, it should be possible to replicate. Okay, and this was the short session. Now let's 5 minutes are left. So if anyone has any question, we'll go for it. Let me stop sharing my screen. Okay, fine. So good. So I'm going to different chats. One is mentioned that I want to learn in detail. So within time limits, whatever I could, I have explained it. Okay, then understanding research design. So I explained research design is very simple. It's all your framework, it's all your planning, it's all your paperwork before you start. Okay, that is your research design. Okay, uh, differentiate it from study design. Study design is something different. Study design is part of research design. Okay, then my expectation is to understand the different. Oh, it went up. My expectation is to understand the different research designs, how to choose appropriate design for study. I can say that it's not like different research design. It is broadly qualitative and quantitative. Then different study designs are there, like observational, interventional. Okay, in that RCT, case control study. Okay, different research design. So okay, how is one research design different than other? So it is broadly qualitative and quantitative only. Able to write a good paper, so very good. Okay, so for writing a good paper, very simple rule: you select the good journals. How to select the good journals? So there is website of Scopus Index, PubMed, and Web of Science. So you search some physiotherapy journals, whichever type of research you want to do, find some similar articles, download it, read it, minimum 4 or 5 articles you read, and then prepare your study accordingly. Okay. Then comes write a good paper that I explain: Scopus, PubMed, and Web of Science. How is the research? Okay, having some idea but need in detail to gain clarity on various types of research design. So that is again qualitative, quantitative overview. So okay, that was there. Appropriate research structure to understand and frame the research based question and make the see research question. It's very good comment here. Research question should be real, it should be useful to society. Okay, so for example, if I do research, which tree has the largest area of leaf or leaves, so that is also research, but that will not be useful to society. But other way, if I think of that these leaves are helpful for good health, so that will be useful to society. So your research question should be such that it will have larger impact and it will be useful to society. Okay. Okay. Madam, how much time do I have, Grishma madam?
So we can still take up a couple of questions. That would be
Okay.
fine.
Okay, fine. So let me try to give their answers. Okay. So framework I explained, just like infrastructure. So infrastructure is anything that is physical. If you are giving ultrasound, your machine is also infrastructure. If you are giving patient position on the plane, that is also your infrastructure. If you are working in clinic or hospital, so that is also infrastructure. So that is infrastructure. Everything that you see physically is your infrastructure. The number of participants. So ideally, it is based on the sample size calculator, based on prevalence, based on population. There is one website, calculator.net. So you just differentiate different type of formulas. Otherwise, more information you can read from C.R. Kothari book and B.K. Mahajan book. One more book I would like to say, that is Hicks. Okay, so Hicks should be read, especially the chapter number 11 and 12. So that gives you number of participants. Population can also be used to find out the sample size. Sometimes you don't have prevalence rate, you have just number of population, like 20,000 knee replacements were done in last year in this area, for example. So that is population, that is not prevalence rate. Prevalence rate means 6 out of 1 lakh they are affected, so that is prevalence rate. Fine. So from population also you can calculate the sample size. So sample is small part, population is large part. Then sampling is the process of selecting small group to represent all. That's perfect. Okay, choosing patient specific condition, sampling good. So almost how to ensure standardization of the research and good for the Google Forms. The Google Form is just survey. Okay, what would be the type of. So there are many questions. I think it's difficult to answer all of them, but you can send me by email. I would like to answer. Okay. So I'm simply writing my email here in the chat box. Okay. So you can put your question there also. Okay. So I'll be happy to answer. Fine.
Sure.
Okay.
Uh, yes. Thank you, sir. Thank you for such an informative session and graciously answering all the questions. Your insights have truly helped us understand how a research design is going to improve the quality of our study. So this brings us to the end of our today's session. It has taken us from very important foundation of research, from identifying a problem, formulating a research question, and choosing a proper research design to answer that questions. So I sincerely thank both of our esteemed speakers, Dr. Ashish sir and Dr. Heta ma'am, for sharing their valuable knowledge and experience with us. I would also like to appreciate the engaging and enthusiastic audience for their participation. Your engagement truly makes these academic discussions more meaningful and impactful. I request audience to kindly fill up the feedback form. It would help us organize the future events in a very smooth way. So thank you everyone. Thank you
Thank
for
you,
being
madam.
part of this day 3 of virtual research series. Stay tuned, stay curious for the day 4, which will take us to the next step of the research, that is data collection methods and sampling methods. So hope to see you all tomorrow with same curiosity. Thank you,
Thank you,
sir.
madam. Madam, I would
Yes,
like
sir.
to take just a few seconds.
Yes, sir.
I would like to tell all the students, research is very essential part of the profession. We always do it. I cannot say with name, but many of the pathies, they are dying just because they have less research in their field. So research gives you longevity for profession also. So we have to be in profession for many years. So we keep doing research, then only it is for the upliftment of the profession. Okay. And here, due to time limit, I cannot explain more, but if you want more of this lectures, my lectures are available on YouTube also, so you may simply search and see them again. Okay. And thank you so much to IAP team for giving me this opportunity.
Thank you, sir. That was truly correct and wise words to say. Thank you, everyone. Thank you for joining. Hope to see you all tomorrow with such curiosity. Thank you.